We're really excited. One of the things that's going on, and this is the first one, this is the first community health education seminar that Anchor's doing, and the concept is to just provide something of value to the community, open up the doors, let people come in and give them something that's valuable, that's just good information. And so tonight's the first one. And the way that this thing sort of came about is, for those of you who don't know, my wife Melanie's a dentist here in Bonita. And over the years, we've talked about how so many people don't really know and understand their dental insurance plans. And I know back when I first started in my career and I would get a job, or when I changed jobs, I would end up sitting down with the HR manager, and they would typically say, okay, well, you've got these 2 or 3 options for medical, and this one works this way, this one works this way, this one works this way, and if you want dental, check here. And that was basically all the information I got, and I definitely didn't go reading the book. So one of the things that we've always noticed is that people, when they come in, our patients don't really understand their plans very well. And we thought, well, one of these days we'd like to do something that would help people understand better their plans. So when Jeff came to me and we were kind of talking about putting together a community seminar, or a community health seminar, I said, man, I've got the presentation. This is something that we need to do. And so as I started thinking about it more and more, as important as it is for you guys to know and understand your dental insurance benefits, there's something much bigger than that going on right now. And that is the changes that are going on with our healthcare system with Obamacare. And so what we basically decided is, why don't we do 2 presentations instead of just one? So tonight we're going to have 2 speakers. One of them is going to be talking about, in a more abbreviated presentation, dental insurance benefits, just a little presentation to help you understand a little bit better your dental plan, and maybe share some things that will help you maximize the benefit of your plan. And then we have a second speaker who's going to be talking about Obamacare and what it actually means to everyone in this room. The thing about Obamacare is, I don't know if anybody out there anywhere knows exactly what it means to everyone in this room, but we have a couple of big experts, or real experts here. And the first one, you can come on up if you want, Barb. Barbara Culbertson is the office manager at Melanie's practice. We've known Barb for 8 or 9 years. Melanie's worked with her in the past, and Barb has worked for us for coming close to a year now, but we've known her for a long time. Melanie's been practicing 18 years, and we've been married just about that whole time. So I've been around dentistry a long time, and I don't think I've ever met, I know, none of our other employees are here, so I'll say this. Barb is the best, I don't say best, that's maybe not the right word. She is the most sophisticated dental employee with her knowledge that I've ever been around. To say that she is a master of dental insurance is not doing her justice. So whenever we thought that we were going to put this program together, it was an automatic. Barb is the perfect person to do this presentation. So she's got a lot of years of experience. I'm not allowed to say how many, but Barb's going to be our first speaker tonight. So I want to thank Barb. Her presentation is just going to be very simple, but hopefully it's going to help everyone understand a little bit more about your dental insurance benefits, and help you understand a little bit more about maybe how you can maximize your plan. And then the big question is, if you don't have dental insurance, should you?
So what I wanted to kind of talk a little bit about tonight is some of the questions that I have gotten over the years. What is my dental insurance? What does it do? How do I maximize my benefits? Or here's a big one, do I need to buy dental insurance? Do I need to purchase dental insurance? Where do I get dental insurance? And those are all really good questions. So I'll kind of go over the 4 basic plans with your dental insurance.
So our next speaker tonight is Lori Ann Martell. And Lori is and I have to have her card because I always forget the name of her practice. I always want to say Naples Medical Center, and it's not. Lori is the practice administrator at Advanced Medical Center, which is in Naples, and she's here to talk about Obamacare. And Obamacare is sort of that term we hear in the news all the time. There's actually a real name for that act. It's I want to let her tell you in just a minute because I can't remember what it's called. But Lori is the president. Also, she's a practice administrator of Advanced Medical Center down in Naples. She's also the president of the local chapter of the Medical Management Association. That's how I know Lori, is through attending those meetings. And Obamacare, nobody knows everything. But there's some people who know a lot more than others. And Lori, kind of like Barb, she's been playing in the game for a long time. She knows the medical system. She knows about Obamacare, and she knows a lot of little things that you guys need to know. And so I'm really glad that you're here. As I was talking to her preparing for this, she was saying, well, I was thinking I might share this, da-da-da-da-da-da-da-da. These are things people need to know before it goes into full effect. And I'm like, yes. So this is not a presentation on whether you think Obamacare is good or bad. We won't be talking about that. Some of it may, she may talk about some things that are, well, here's some of the positives that are going to affect you as the patient. Here's some of the negatives that are going to affect you as the patient. But she's not getting into, it has nothing to do with politics or any of that. And that's the bad thing about Obamacare itself, is that we typically hear about it in a sort of politicized message. And, honestly, we just need to hear the facts so that we can go on with our lives and know how to make whatever our healthcare system is work for us and get the most out of it and so forth. And that's what Lori's going to talk about. So I'm going to turn it over to Lori, who's going to solve all the mystery.
It was really interesting in writing this. Usually when I do PowerPoint presentations, I know a whole lot more about my crowd that I'm talking to. I didn't know if I was having families, if I was having seniors, and I just thought, you know what? The basics are really good for everybody to understand, but often I'll put like cartoons and funny things in there, and I thought, this is so political, it's going to be the most boring PowerPoint you've probably ever seen, because I thought I'm just going to stay right down the middle with it, no personal opinions, and give you the facts of things that you need to know. So I thought the best thing to go back to is back to the beginning, and absent of the politics. I know as a practice administrator, I'm a nurse, first and foremost.